Cool. Well, thank you for joining the SFY 2025 Grantee Survey Training. This is a little bit of a different training because we actually have grantees from multiple funding streams joining us today, because this year we also have the Opioid Settlement Fund grants in addition to the Substance Use Prevention Treatment Recovery Services Block Grant. So this is a training for all of those grantees to be able to learn more and provide that support to help you guys administer the program participant surveys during SFY 2025. So appreciate you guys joining today, and hopefully this can be helpful. So a little bit that we're going to go over today, we're going to start off with survey overview, who uses surveys and why do they matter, as well as at that point in time, we'll go over some of the changes that were made to the surveys in SFY 2025. And then we'll dive into survey instructions, how to access surveys, how to implement surveys, obtaining parental consent, as well as some tips, tricks, and which I think tips, tricks can be misguiding. It's a bit more of, recommendations and strong suggestions for ways to implement the surveys to make sure that they are implemented correctly and we can actually utilize that data. And then we'll dive into survey discussion, where grantees will have an opportunity to both ask us questions and also discuss surveys amongst yourselves. Hopefully, I think that we can kind of go over this pretty quickly today, and then hopefully we'll have some good time for grantee discussion and Q&A. And I also want to start off really quick with just some brief introductions. My name's Jessie Dexter. I'm the SUPTRS Block Grant Project Director with the Office of Drug Policy. And then I also have Marianne King and Grace Tucker on the call with us. So I oversee the SUPTRS Block Grant, those grantees, and then Grace supports me with the actual survey collection and all of that evaluation and all of that interaction with us and our different contractors who support us on this work. So Marianne, can you introduce yourself real quick?
Yeah, happy to. Hi, everyone. Marianne King. I serve as the director of the Governor's Office of Drug Policy. So we are the ones that get this money out the door into local communities so that you guys can all do the great work that you do, and very much appreciate the work that you do and the impact that you're having on our kids, on our families, and on our communities in general. So thank you for joining in, and thank you for being a part of making sure that we get the data to show what you're doing to other folks.
Grace?
Hey, everybody. Yeah, my name's Grace Tucker, and I'm the research analyst for ODP, and I am, just as Jessie said, helping to collect surveys. So I'll probably have a little bit more interaction with you guys as you deliver your programs and gather your surveys. But yeah, it's nice to meet you all.
Thank you, Grace. Okay, so now looking at participant survey overview. So who uses surveys? Not all of our grantees are on the call today because our surveys are only used by grantees that are specifically receive funding to implement direct service, evidence-based programs and evidence-based curriculums. So only grantees that are providing those direct service, evidence-based programs such as life skills, positive action, strengthening families, etc., are required to conduct surveys with program participants at the end of each cohort of the program. And a number of different curriculums have their own surveys that were created by the curriculum developers, but these surveys are different. These are surveys that come directly from our office, and all of our, let someone in from the waiting room. All of our grantees that do these implement direct service evidence-based programs utilize the same survey that our office created because it allows us to evaluate the surveys or evaluate programs across the board and see the impact of our programs all across the state with different populations and demographics. So those are the specific grantees from our office that utilize these surveys, and that's why you've been getting the emails from me this week. So then when we talk about the value of these surveys, there's kind of a two-piece to it. So one, there's immense value for ODP. ODP uses the survey data to inform our overall annual state level grant program evaluation. This helps us identify which evidence-based programs and curriculums are being successful and having the greatest impact with different populations, and it can help us guide grant management and grant funding decisions in the future. Additionally, this funding This information also allows ODP to demonstrate the impact of our funding streams, such as the Scepter's Block Grant and the Opioid Settlement Funds grants, and other funding to the state legislature. In recent years, the legislature has asked us how we knew if the programs that we were funding were getting a bang for our buck. And outcome data from these participant surveys over the years did allow us to complete a cost-benefit analysis back in 2021. And the findings of that cost-benefit analysis actually found that for every $1 invested in substance use prevention in the state of Idaho, we gained a benefit of $20.63. So this was really exciting because it clearly demonstrates that the work of prevention providers like you guys implementing these comprehensive multifaceted strategies to affect youth substance use in your areas have been effective in utilizing public funds to reduce youth substance use. And it helps us continue to justify to the state legislature why we need spending authority on these funds to continue giving out these grants to communities across the state. But surveys also provide a great value to grantees. After the program year, eligible providers will receive a summary outcomes report of their program surveys or survey results. And by eligible providers, and I'm going to have Grace dive into this a little bit later, but by eligible providers, that means that grantees or program providers that receive more than 25 surveys for each or a specific program, you have to receive at least 25 surveys in order to be eligible to receive a kind of program level outcomes report. But those reports, as well as the state level report, can help grantees understand the impact and value of different evidence-based programs. And the outcome data can help grantees demonstrate their impact and be used to help guide and strengthen their applications for future grant cycles. Additionally, the data can be used to support efforts to receive grant funds, both from ODP, but also from other sources. So both the state and provider level reports that we produce from these surveys can really be beneficial to both our office and to our grantees to help us understand what different programs around the state really make the most difference and which programs we should be looking at implementing with different populations, different age groups and whatnot. So there's a very strong value for our office, and we hope that you find value in them as well. It's important to know if what you're doing is making a difference. A difference in the way you want it to make a difference, also important. So as I mentioned earlier, our survey was, experienced some significant changes this year. Historically, our office has done 3 different surveys. We've had a younger youth survey with grades 4 through 5, and then we had an older youth survey with grades 6 through 12. So we had 2 youth surveys that our grantees implemented with different age program participants. And also these youth surveys were in a pre-post format. So grantees got one survey that was both a pre and a post, and they had to implement it on day 1 of the curriculum, and then also implement a post on the very final day of the curriculum of each cohort. And this year, in an effort to try to make the survey process more efficient and streamlined and easier, as we know surveys and parental consent, all of this has become a bigger burden over the last couple of years in our grantees. We eliminated the younger youth survey, so our grantees no longer have to implement surveys with youth that are in grades 4 through 5. Grantees we've never required or requested surveying of youth under grades 4. But this year, there's no longer a younger youth survey, so our providers only have to implement surveys with older youth participants that are in grades 6 through 12. And additionally, that older youth survey for youth in grades 6 through 12, it transitioned to a retrospective format. Historically, as I mentioned, it was pre and a post, so all of our grantees had to do the survey with every cohort twice. Now, in the retrospective format, it allows our grantees to only have to implement this survey one time on the very last day of the curriculum. So after you've completed implementing the curriculum with a cohort, you then have them complete the retrospective older youth survey once. So hopefully that does make the surveying process a little bit easier for you all. And I think we also continued to experience a number of challenges relating to the pre and the post, with the pre-post bubbles not being filled in, or we receive a lot more pre than we do post, or a lot more post than we do pre. So I think that we feel that this transition to the retrospective format will make this survey process easier and hopefully cleaner and more simplified for everyone involved. We do also have a parent survey that has always been retrospective, and that survey has not changed this year. So these are the only changes, these are the primary changes to the surveys in SFY 2025. Okay. So looking at the kind of participant survey overview, as we've kind of gone over now, this year we have two types of surveys. We have the older youth in grades 6 through 12 survey, which is a retrospective format. And then we have the parent survey, which is also in a retrospective format. The parent survey is available in English and Spanish. And for all of our grantees that are implementing parent programs, I just automatically gave you English and Spanish paper-based surveys. And I sent those out earlier this week. And these surveys can also be found in your grantee portal in Neighborly. But every grantee implementing those parent programs received in English and Spanish. We historically have not provided a Spanish older youth survey because no grantees have requested it. If you do feel that you need an older youth survey for grades 6 through 12 in Spanish, let us know, and we can definitely work with our contractor to get that to you. We've just, at this point in time, never had a grantee need a Spanish older youth survey. But if that is a need, we're happy to work with you, so just let us know. And then the survey formats, we offer the surveys in two formats. The first is paper-based. Paper-based is the primary way in which our grantees implement surveys. We send you the PDF copies of the surveys. You print them out, you implement them with your participants, and then you collect them and mail them back to us. However, during COVID, a number of our grantees began using online computer-based surveys. Since COVID, only a couple of our grantees have continued using online computer-based surveys, but we still offer that as an option for everyone. However, while we always create these paper-based surveys for you, we create the online and computer-based format surveys for you upon request. So in the survey administration instructions, there is a link, and we'll also go over it later in this presentation. There's a link to a form to request computer-based surveys for different programs as needed. And we will work with our survey contractor to create those for you and get them over your way. We just don't create them automatically because so few people use them. Are there any questions at this point in time? Okay. Okay, survey instructions. So first, how to access the surveys. The paper-based surveys were shared out via email. So you or someone at your organization should have received copies of those paper-based surveys, their PDF format, received them via email. And I've also uploaded all of them into your grantee portals in Neighborly. So if you go to your grantee portal in Neighborly, on the left-hand navigation menu, so you'll log in Neighborly, there will be your dashboard, and then you'll click on your grantee portal. On the left-hand navigation menu, there will be a tab that says Documents. And in that Documents tab, that's where I have uploaded copies of your participant surveys. So you can also find them there as well. So a couple different options. And then again, online computer-based surveys, these are provided upon request. So you'll complete this form. It's that jot form hyperlinked right there. It's also in the survey administration instructions. I can also share it out after this in the follow-up email after this webinar, but that's how you request online computer-based surveys. And then survey administration instructions. The survey administration instructions, example survey templates, parental consent information, and other resources can be found on ODP's prevention website. Under the provider information webpage, there's a tab that says surveys. And if you open that up, all of these links are there. The program survey administration instructions, that image on the screen. Oh, sorry, we have someone else in the waiting room. Let them in. That image on the screen, that was shared out with everyone in the email when I sent you your paper-based surveys in that email. And they're also hyperlinked, like you can access the downloadable PDF from that website link, and I'll share them out again in that email. And the email I sent out after this webinar, but those have been updated, and I strongly encourage everyone to review the survey administration instructions prior to implementation of any surveys or any survey administration. They have a lot of great information, and it's very important that surveys are administered correctly, in order for them to be used at the state level and provider level evaluation. Oh, So survey instructions, who to survey. If possible, ODP recommends that you survey all participants that receive direct service evidence-based curriculum programs, youth and parent participants. If your program serves more than 300 participants and you're not able to survey all of them, notify ODP and we will randomly select cohorts for you to survey. And providers with less than 300 program participants will be asked to administer the survey to all participants. And again, participants in grades 5 and under should not be surveyed. And we also have those 2 surveys. So when you do survey your program participants, sometimes our grantees have parent programs where we only have parents participating. There's also youth programs where there's only youth participating, and there's sometimes family programs where youth and parents participate. So make sure that you use the correct survey form with the correct population. If you're surveying parents, make sure to use the retrospective parent survey. And if you're surveying those older youth in grades 6 through 12, make sure to use that youth survey. Okay, obtaining parental consent. So parental consent must be obtained by providers before the implementation of youth surveys. Prevention providers administering grant-funded student surveys have the option of using passive parental consent or active parental consent, depending on the preferences of the stakeholders involved. Parental consent around surveys has gotten a bit more complicated recently with legislation passed in January of 2023. And ODP has continued to work with the State Department of Ed and our partners to clarify whether active parental consent is required and whatnot. And at this point in time, we continue to give our grantees, because not all of our grantees work specifically in schools or with school-based participants. So we, across the board, continue to give our grantees the option to choose passive or active parental consent. And then when you work with your partners or your organization to implement the program, in those conversations if you are working with schools, if you're working with after-school programs or youth serving organizations, that's when you and your partners identify if you should use passive or active consent and which route you're going to choose. Under the passive consent procedures, parents and guardians inform the program facilitator only if they do not want their child to participate in the survey process or opt out. And then under active consent procedures, parents and guardians inform the program facilitator only if they do want their child to participate in the survey or opt in. Providers are responsible for keeping a list of youth whose parents have declined their participation in the survey, and be sure to administer the survey only to youth whose parents have not declined their participation. Note that parental consent is directed at surveys and not program participation. So students can still participate in the programming, just not the survey. So if their parents decline to allow them to participate or decline parental consent, the student can still participate in the programming. They can just not participate in the survey unless otherwise specified by the parents that they don't want their student to participate in any of it. So before implementing youth surveys, providers should review the parental consent policy on substance abuse prevention programs serving minors. And that's located on that prevention provider information webpage. It's also hyperlinked in the survey administration instructions, and more information, including ODP parental consent policy, the sample survey forms, and a fillable PDF parental consent form. All of that can be found on that ODP prevention website as well. And I'll also share that link out in the follow-up email after this webinar. Marianne, did you have any other thoughts on the parental consent process that you wanted to share?
I would just add that I just think it's so important to communicate with parents, make sure that they have the opportunity to see the survey and to understand what the survey is asking, and then also how we are measuring the program. It is about measuring the program, not their student, not their family, but we are really looking to see, does this program make a difference? And I think the more information you can share with the parents and make sure that they have an opportunity to read the survey questions, the better off you are. We find that a lot of people are just saying, I don't want my kids to do any kind of survey, but then once they understand why it's happening and exactly what it entails, details, they're like, yes, please, we need this information. We want to know this, if this program is working or not. So just stressing that this is a program evaluation, not an evaluation of any individual or any group of individuals, and how we use that information. And I think that has proven to be very helpful, just making that information available to anyone and everyone who asks.
Thank you, Marianne. And also note that all of these surveys are anonymous. So student participation, like their students' names, there's nothing identifying that ties students to these surveys. Surveys are completely anonymous. And one of the reasons why we only provide provider level and program level reports to providers who are able to gather a minimum of 25 surveys, part of that is because that helps ensure anonymity among the students who do complete the surveys. Grace, do you feel like this would be a good time to speak a little bit more to that number, that 25 number, and the reasoning behind that?
Yeah. So the reason we selected 25 is because there's a little bit of research out there that does say that there should be a threshold of, there's a conversation about 25 or 30. And then the real reason is because of statistical significance. So when there is when you get a large number of surveys, statistical significance is really easily detectable. And even a small amount of change is detectable. And then when the lower number of surveys you get, change becomes harder and harder to detect. And then also statistical significance of that change becomes very difficult to detect. So you might be implementing a program, and there is significance and you're moving things in the right direction, but we would be unable to detect it just because of how statistics works. And so we don't want you to give us the data that you have and it's like, say it's a lower number, like 15, and for us to not be able to find the significance there and have it be discouraging. So 25 or 30 is kind of the accepted number, like lowest number for there to be a reasonable amount of surveys for us to detect significance. So it's a little bit technical, but it's protecting you guys and it's just ensuring that when there is change that we're able to register that change. So.
Great. Thank you, Grace. And just to clarify, so even if you know that a cohort is going to be less than 25, or you're going to implement a program with less than 25 participants, you do still need to do the participant survey because that number, those surveys still help contribute to the overall state level analysis. So you still need to administer the survey. Unfortunately, we just won't be able to give you a provider program level specific outcomes report for how your program did with this specific population. However, you still need to administer those surveys and send them into ODP because they are still vital to the state level evaluation to help us see how that program performed as a whole across the state. Any questions around parental consent before we move forward? You can either put them in the chat or you can unmute yourself and go ahead and ask it, or just let us know. Okay. So participant survey instructions, kind of continuing. Once parental consent is obtained and the program participants are surveyed, the completed paper-based surveys will be sent to ODP by mail. You can also drop them off at our office in person if you want, but typically for majority of our grantees, the most convenient way to get them to us is by mail. ODP's mailing address is 304 North 8th Street. It's Suite 455 in Boise, Idaho, 83720. We have 2 zip codes. You can do 83720 or 83702. This mailing address is also listed in the program survey administration instructions. So mail those to us, and please note that when grantees use online surveys, the program participants will submit their survey responses online, and ODP and our evaluator will collect those responses through the online submission. So grantees do not need to worry about trying to print off online computer-based survey responses to try to mail them into us. Those are automatically collected. You do not need to make copies of the program. Like, so after program participants submit their surveys, you don't need to make copies of them. You don't upload copies of paper-based surveys into Neighborly. You don't send those to us via email. You have to mail us the paper-based, like the copy of the paper-based survey. So we actually need the real paper-based survey. And you don't need to keep copies of any paper-based surveys on hand. So when those students submit them, they'll go in an envelope and you send that directly to ODP. Okay. Lastly, because we process surveys in batches, you do not need to wait until all of your surveys have been collected across the entire year to mail them in. You can send them in batches, and we recommend that our grantees track the delivery of all of your packages to make sure that they get to ODP successfully. And starting in Q2, there will also be a question on your quarterly activity reports asking if you had submitted any surveys to ODP during that quarter. So we'll also kind of track that at that point in time as well. And when you do mail surveys to us, keep the mailing receipt and ODP will reimburse you for the costs of shipping to get those surveys to us. So just to go over the timeline really quick. So sorry, it says FY24, but this is for the FY25 grant timeline. And this is for all grantees. This is block grant as well as opioid settlement fund grantees. The grant period started, the SFY 2025 grant award period started July 1 of this year, and it ends June 30th of 2025. They have those 4 quarters in between. So surveys and those quarterly activity reports are separate. So your quarterly activity reports, the Q1 activity report was due at the beginning of this month. We're currently in Q2 of the SFY award period. The Q2 activity report will be January 10th. And then Q3, that due date is April 10th. And then the final quarterly activity report will be due July 10th for that quarter that goes April to June. And the reimbursement request deadline for our grants is June 15th of 2025. You can submit reimbursement requests at any point throughout the grant year. You can do it weekly, monthly, biweekly, however you want to do it. Some grantees do it quarterly, but you can submit reimbursement requests at any point in time. You can send those paper-based surveys to us at any point in time, but the deadline to submit mail-in paper-based surveys to ODP is July 15th of 2025. So we'll need all of those surveys by the end of July. Okay, next we're just going to go over tips and tricks, which again is a bit misleading because these are actually strong recommendations. And if you do not always implement surveys or administer them in this way, that will impact our ability to make them usable for evaluation. So one, we ask that you print all 2-page surveys as double-sided. So both our retrospective older youth survey and our retrospective parent survey, they are 2 pages, and they're intended to be printed on one piece of paper, front and back. So the way we recommend, you have to, if possible, print the surveys as one double-sided page. And because of the survey format, since it's a landscape, we recommend that you flip them on the short edge when you're setting up your printing instructions. And that's just because that'll just determine that when it's printed, if both sides, start at the same top and bottom, or if it's switched. So the flipping on the short edge isn't critical, but it just, in my opinion, makes the surveys a little bit easier to complete for the participants. So print all surveys as 1-page double-sided, flipping on the short edge. We have a couple more people in the waiting room. So each survey fits on one piece of paper. If you do not have the capability to print double-sided, please let ODP know, and we can print off surveys for you and mail them to you. So it just gets very tricky if surveys are printed as 2 separate pieces of paper, because then it's very hard for ODP and our evaluator to track which front and back page of the surveys match. So that makes it a little bit challenging. So again, if you're not able to do double-sided printing on your own, send ODP an email and we will print those surveys for you and we can mail them to you. And then make sure that the surveys remain anonymous, so participants do not write their names on the surveys. That's very important. And then when they're collected in the administration instructions, there's instructions on how to collect them, but we typically recommend that you put an envelope in the front of the room and have students or participants, after they're done with the survey, go and put their survey paper documentation in the envelope. But very important that they remain anonymous and do not receive any names or identifying information. If you're using a copier, so for some reason, if you have your paper-based survey and you print off one copy and then you just want to make copies from that one printed off copy of it, you should make copies from the original printout. If you make copies of copies, the quality of the print and everything starts to get a little bit more challenging. So if you do want to make copies, use the original printout for that original copy. And print out or make all copies on regular white printer paper. Don't use colored paper, as this can cause the scanning software that our optical survey scanning contractor uses to read all the responses as marked. In the surveys, respondents will fill in bubbles. And so make sure that respondents use dark colored ballpoint pens or pencils. We do not recommend using markers or felt tip pens because these can bleed through the paper and cause errors in responses for the scanning software. So we recommend dark colored ballpoint pen or pencil. We also recommend you avoid crayons or highlighters or any of those things because they can cause issues with the scanning software. So in the survey instructions, we also include a note where you might want to have some pens and pencils on hand when you're implementing the survey. So if you have any participants that need a pen or pencil, they can get one from you in order to ensure that the survey is administered successfully. We do not recommend that respondents complete the surveys while eating or immediately after an art project or any of those things, or complete the surveys on surveys that surveys on surfaces, there we go, that might have had food or art supplies on them. Anything that sticks to the paper, like food or paint or liquid, it can cause the survey to jam in the scanner and potentially destroy the survey and or damage the scanner. So this also includes no whiteout to correct a response. If an error is made, respondents can cross out the incorrect response and mark their intended response. These surveys are both scanned and reviewed by humans, so we're able to capture some of those errors. So that's how a student would correct an incorrect response. No whiteout. Make sure to only use the SFY 2025 surveys provided by ODP. This is especially important because our surveys changed pretty significantly between last year and this year. So make sure to use the correct SFY 2025 survey form. And we also recommend that grantees track the delivery of all survey packages mailed to ODP to ensure successful delivery. I think that's the last one there, but I did want to add a couple other things I strongly encourage are, one, to please read the survey administration instructions document that we put together for you guys. It has step-by-step guidance for administering paper-based surveys. It goes, it goes through the obtaining parental consent, accessing and downloading your paper survey documents, printing them and making sure they're printed correctly, getting a large envelope for participants to submit the survey in. And it also includes a script for providers to read. So there's an older youth survey script and a parent program survey script. And you don't have to read the script like word for word, but we strongly encourage reading over the script. And this is just what you would read to program participants right after you distribute the surveys. And I think that it is especially important this year because of the retrospective format. On one half of the survey, it asks them to, to respond to the question with their perspectives or behaviors before the program. And on the other half, it asks them to respond to the questions with their perspective and behavior after the program. And those sides are actually different on the youth and parent survey. So on the youth survey, on the left-hand side, actually, I'm just going to share my screen and show you guys this really quick. 1 second. Okay. So you guys should all be seeing my other screen. So I'm going to show you where some of the stuff is. Pull it up. Oh, so here's the program survey administration instructions if you haven't looked them over already. But it goes through a lot of what we covered in this webinar today. When to administer surveys, who to administer them with, and then instructions. And then when you get down to this, so older youth and parent survey administration scripts, the older youth survey, here is the older youth survey script right here. And then the parent survey, here's the parent survey script. So hopefully that is helpful for you guys. Again, you don't have to follow it word for word, but hopefully it can at least provide a framework for you to know how to prompt and deliver the survey to program participants and what guidance to give them when they are completing the surveys. And then it also has instructions on how to collect the survey and then mail them to ODP. And then again, all of the reminders that we covered today are also in here about how to print the surveys to make sure they're printed correctly, how to administer them to make sure they're administered correctly, and then shipping them to us. And then down at the bottom is the instructions for the online computer-based surveys, including that link to request them from our office. Sorry, my computer gets very slow when I'm on a Zoom call. So here is an example of the parent survey. You'll see this is a retrospective survey. So the questions are in the middle, and then on the left side for each question, participants are asked to choose the option that best indicates how often each item currently occurs now that you have taken the program. So the parent survey has always been like this. There is, some science at the reasoning of why the now and the after and the before are on these different sides. Sorry, I'm actually looking at this and I'm realizing that this template was done incorrectly. But on the parent survey, on the left side, it's the now, and then on the right side, it's the before. And then let me pull up the youth survey. So they're switched, and we left the parent survey as it was because the parent survey always had the before on the left and the after, or the after on the left and the before on the right. It's very confusing, but that's how the parent survey always has been. When we made the older youth survey, we chose to have the before on the left and the after on the right. So on the left side, mark the answer for each question that best fit you before you start the program, and on the right side, mark the answer for each question that best fits you now that you have completed the program. So all that to say that guidance on this is actually included in the survey scripts in the survey administration document. So we note that in the survey scripts. So if you do use the survey scripts to help guide what you say to program participants, those scripts will help give clarification to the program participants to note that, one side is before and one side is after. Sorry if that seemed very confusing. I feel like I ended up explaining that in probably the most confusing way possible, but hopefully it made sense. Are there any questions about that or any of this so far? Okay, great. And actually, that is it. So yeah, Grace will be the primary contact for survey questions or when you're mailing in the surveys or any survey issues moving forward. And so her email address is listed in multiple places in the survey instructions document. And so, yeah, you can feel free to reach out to me or reach out to Grace if you have any questions about pre-post surveys as you're going through it, or if you have any issues, if you are missing a survey or if there's an error on your survey, feel free to reach out and let us know. But yeah, please note that Grace Tucker is going to be your primary and best resource from ODP for survey related questions.